As workers set up a COVID-19 vaccine clinic under tents in a vast park, volunteers in Southgate hit the streets, knocking on doors and chatting up street vendors to spread the word. In Chinatown, outreach workers are ducking into restaurants, urging line cooks and servers to walk down the block and get the shot. And in South Los Angeles, a young volunteer is papering telephone poles with flyers containing appointment information. With pressure mounting for California to keep reopening schools and businesses, much is riding on the vast, wildly varied efforts of volunteers to find and vaccinate some of the state's hardest-to-reach populations, many of whom do not have cars, reliable internet access, legal documentation or enough free time to search for an appointment. Nearly half of all vaccines in California are going to about 400 zip codes identified as high need, and state health officials have hinged the state's reopening plan on how quickly those doses can be distributed. Entrusted with the job as a broad collection of community groups, including predominantly Latino churches, Chinatown nonprofits, a black sorority and members of the Ethiopian business community. So far, 2 million doses have been distributed in those zip codes, with 2 million more to go before the state will consider lifting restrictions any further. For many of the nearly 10 million Californians who have already received a dose of the COVID-19 vaccine, the process has been almost universally frustrating, but relatively straightforward. They have sifted through multiple websites, sometimes waking up in the middle of the night or refreshing web pages multiple times to score an appointment. But that system doesn't work as well in communities hit hardest by the virus, where essential workers juggle multiple jobs, unreliable internet and a fear of government services. Getting doses into arms requires significant help from grassroots organizations that know their communities and know how to reach them. That often involves going offline. Volunteers have traded online advertising for old-school organizing, speaking face-to-face, making phone calls and handing out flyers. Their hope is to spread the word widely enough that locals know where to go, but not so widely that residents from other parts of Los Angeles County flood the clinics and snap up scarce appointments. It was a decision early on to say, "No internet," said State Assemblymember Cristina Garcia, D. Bell Gardens, who helped organize and schedule appointments for the Southgate Clinic. "It is a little more work, but it's worth it to make sure the shots are going into the arms of our community members." For many organizations, knowing the needs of the city's wide range of ethnic groups is key.